So hello to all the viewers. I'm so very happy to introduce to you two of our toppers, and you can see both of them sharing the same screen because they are probably the ideal couple, I should say. They've got some great ranks to their credit. Dr. Digvijay got a rank of 52, and Dr. Kranti rank 3 for the NEET SS Medical Group Entrance Examinations. And first of all, outstanding achievement. Hearty congratulations to both of you.
Thank you, sir. Thank you.
Right. So, to begin with, let me just ask you, like you've given the exam, NEET SS Medical Group. We all know how unpredictable the exam pattern is. Coming out of the exam hall, what were your initial thoughts? Kranti, did you already think that, okay, I'm going to crack within top 10? Did you already start celebration, or, you were actually...
No, sir. This was not the thought that has crossed my mind. Not at all. I was expecting something. If I would have a rank of 500 also, I would have been this happy.
Okay, right. And Digvijay, what about you?
Sir, I was terribly sad because last time when I NEET SS with minimal preparation, I was really happy because the exam was quite easy. And this time when I came, the last part, section C was terrible because it was all about hypothermia, then palliative care.
I think environmental emergencies and toxicologies dominated that particular set, right?
Yes. And sir, the questions were so in detail that it was very difficult to choose out of the last two options that we had come down to. Right. They were very close. Like they had asked the next step. And the subsequent question were like next step. What will be the next step? The next question, similar question, but the next step. So it was very difficult and large, long stem questions, which took time.
And long options, so that it took time for us to complete.
Now coming to your preparation journey with doc tutorials. Now we know how vast the syllabus is. And first I just want to know from you about your MCQ practice. Have you done the doc tutorials QBank, and approximately what percentage of QBank you have done, and how did it help you in your preparation?
Yes, sir. We have started the preparation with the subscription of the doc tutorial, and we have completed the complete QBank we have completed, and we have completed it multiple times, so that we had a fixed thing in our mind according to flow chart.
Right. So which means you have done 100% of QBank and you went through it multiple times for reinforcement as well. Okay.
Yes.
Now this is something that, I just want to share with the viewers because I've done multiple interviews of toppers. Most of them actually told me about 100% coverage, and not just that, repeating and revising it, because I think through questions, a retrospective method, I think that actually helped them to retain the information is what I assume. So what about the quality of questions in the doc tutorials QBank? Did it actually help you in your NEET SS preparation? Was it more or less in tune with the NEET SS pattern?
Yes, sir. The questions were Harrison based, which helped us a lot. And even the explanation was the paragraphs from Harrison's. So solving questions and reading the explanation in short gave you a view of Harrison's itself.
Okay.
And going back to Harrison after reading the explanation made much easier for us to understand the topic.
Right, got it. And when you read a particular topic, say from Harrison, and you did the question bank, did you find areas that you probably neglected in the first reading of Harrison, and then you retrospectively came back to Harrison? Did you feel like that?
Definitely, yes, sir. Yes, definitely. That was the reason for us to solve the question multiple times. Every time we read the Harrison's and question bank, it helped us. It gave us a new view about the topic. It gave us much clarity. Every time we repeated the question bank and we have gone back to Harrison, it was a much better view for us.
Right. Now, the next thing I want
better approaches. So the better approach is to solve the topic-wise MCQs, then read Harrison's, and then again solve it. So then we realize while solving for the first time, we understand what are the important points where we need to focus during reading. So when we read it with focus and again solve it, then we reinforce the material which we have read.
I think that is right. And next, I just want to ask you about the mini test that we did in doc tutorials. So one thing that we have taken care in doc tutorials is to give you time bound targets. So because see, rather than just being a course of some video lectures and QBank, we all know at this particular age we may not have that motivation to learn as we were learning during our NEET PG or INI days. So a target driven approach will always help is what I felt, which is why we have always gone for such mini test. So can you just take us through your experience of the mini tests that were done in doc tutorials, and did it give you a push and a direction while preparing for NEET SS exam?
Yeah, yes, sir, definitely. We have followed completely the doc tutorial timetable. We used to complete the topic according to the timetable, and we used to give the test. And then we had a gap of after every subject we had a gap of about 3 days. So we used to revise the subject after completing it. So it helped us a lot in revision and everything.
And because the mini test, like in rheumatology, there was a section of mini test wherein the questions was on anaphylaxis, systemic mastocytosis. So before that mini test, we also read those topics, which we generally try and ignore.
Try to ignore.
But because of the mini test, and it was given time there. So what did we do? We read those topics. We solved previous mini test of the similar topics, and then when the mini test came live, we gave it live.
Got it.
So that helped us cover those topics as well.
Right. And also, along with that, I just want to ask, how did you support each other? Because we all know how this journey is like. Even when you started preparing for NEET SS, you never had a date in mind. And I'm sure that, you are like you were doing a bond at that time, and a lot of things would actually go through your mind, responsibilities. And how did you support each other, and, what kept you going?
So actually, the advantage we had was if she read some topic, she would just narrate me in a shorter way, and I would just give her a gist of the topic in a shorter way, which made our first reading quite easy. But the tough part being together was I had a pressure that she should also get a good rank, and even I should also get a good rank, because we both wanted to land up in the same city, in and around each other. So that also created a pressure.
A lot of pressure on
Both of us. We had pressure of each other previously.
Yeah, but let me tell you something. Having taught for many years, both for NEET, PG, SS, I've always seen, couples when they prepare, they have that in with them like, okay, we want to get in the same college without each of them compromising on their branch as well. Because I've had scenarios where other like one of you might have to compromise on your branch, but I think the position that you are in, both of you are in right now, with your hard work and dedication over the last several months, you get to choose whichever college and branch that you want. So none of you have to compromise on anything. So that is, I think, a result that you've got after months of hard work, right?
Yes, sir.
Yes, sir. Definitely.
Right. And now coming to grand test, I always believe that GTs are the actual test. And many a times in the quest of reading more and more, many people neglect GTs. So can I know from both of you how important were GTs in your preparation, and how did you find the doc tutorials GTs as well?
So the day we started our preparation, in the first 15 to 20 days, we understood that only by reading Harrison or only by reading theory, it is not going to work. So we are realizing first 15-20 days that giving GT is the utmost important thing. In fact, it is the only thing one can do, and go back and read the questions which are wrong or whichever what are right. So giving GT was our core part. That was the main part. And doc tutorial has helped us a lot in that. We have thoroughly followed all the GTs of doc tutorial. We have read the explanations of whatever the topics that were new for us, the topics which we have not read, and it has helped us a lot. GTs doc tutorial GT was my main core for preparation of NEET SS.
So the best part about GT is, like, for example, now if we have read neuro for the first 15 days, and we have not revised any other topic, after giving GT, what happens is we review neuro as well. But At the same time, we understand the important things, the must know things
Yeah.
of other topics like cardiology or infectious disease. What are the must know parts? So giving GT every 15 days is very important. Even if you have not read everything, after giving GT, we understand the most important points which we need to remember. So which helps some or the other way in solving the next GTs and the following GTs as well.
Got it.
Yeah. And
And can you,
my
yeah, please.
Yeah, my main preparation thing was to solve the questions. Maybe it is from GTs or it is from question bank, but solving at least 50 to 80 questions the day. Sometimes it used to happen that we used to get tired. It was like we don't want to read or something. On that days, I used to follow. I used to give a GTs, random GTs or question bank custom model. I used to prepare, and I used to give the random question solving. I used to do, so that helped me
Right.
a lot in random topics also. Like we give more importance to endocrinology, neurology, gastrology, but some topics like environmental medicine, critical care, we do tend to ignore that topics, but because of this strategy, those questions were also solved by me.
So the
And I
best
think,
part is that we can solve the GT again.
yeah, some of the questions, I think,
So the best,
by chance, similar question actually came for the actual exam also, is what I understand. A few questions from environmental medicine toxicology, right?
Yes.
sir, the question was of high altitude pulmonary edema. So, which
Right,
of the following is false? And it
right.
is more common in females. It was given. So this is very factual thing. But the similar question was there in
The
doctoral
yeah.
GT,
Got it.
and
Got it.
we didn't know the answer. But
Right.
the after solving multiple questions, the intuition comes in with you.
Yeah.
Like we feel that this is the answer, and then we go on with it, and it comes out to be right. And that is what I feel it decides the rank.
Right. And just one last question, like, during the exam, like, did you have any specific strategy to deal with time bound blocks? Like, if you can advise to the candidates, if you have got, okay, like this sort of a strategy I had, dealing with time bound slots for the NEET SS medical group, like time strategy or anything of such advice you can give to the juniors?
So, for what I did was I always read the last few lines to understand
Okay,
what the question was about, and then
okay,
see the options to understand on which topic it's asked on. For example, if the options were like celiac disease, tropical flu, Whipple disease, so I could understand the question is on absorption from Harrison's,
okay,
like gastroenterology topic related to absorption. Now, when I read the question, I immediately pick up the keywords which are put into the question, and then that becomes easy to answer the question. Now,
got it.
the other way around, if we read it from the top, then it takes time for us to realize whether the question is from which topic, and then
Okay,
we have to read it again. So rather, read the last line, see the options, and then read the question. So this
got it.
saves a lot of time.
Yeah, reading the last line tells you whether they have asked about treatment or whether they have asked about diagnosis. Because if we start from the start of the question, our mind is busy thinking what is diagnosis. But by then we know they have given the question what is the diagnosis.
Diagnosis.
They have asked the
Right,
treatment. So if we read the last line first, we know whether what they are asking, whether treatment investigation is asked or whatever they have asked. We get to know from the last line.
right. And how were your scores in the GTs, the doc tutorials GTs? Like, did it actually help you? Because many of the seriously preparing candidates would have given the exam. So, to understand where you stand, how much you have to improve. So, did those ranks actually motivate you to study even better?
Yes, sir, definitely. Because getting a rank below 20 always motivated both of us. So it was like,
Okay,
yes, if we are doing this here, it is possible for us to do in the main exam as well. So it was surely motivating, and yes, sir, it was
So
motivating.
our ranks were around always around first 100. Sometimes it
okay,
was a 90, 66, 50, 35, 20, 15. So it varied. So
right.
it varied. So we were not sure whether this will really translate into the main final exam. But that
Yeah,
motivated us, saying that
Yeah,
we are
that
doing good, we are in the right direction.
yeah, it gave us a feeling
actually,
of being in competition.
right. Because actually, sometimes what happens is, when students give the GTs, Now, most of the seriously preparing candidates would be giving the doc tutorial CTs. So sometimes students ask me, sir, my rank in doc tutorial CT with this many number of students is this. So should I multiply by this number to get my actual rank? I always tell the students that, look, most of them who are seriously preparing would give the GT. So there is no need to extrapolate, because if you also have gone through your current ranks, you might have seen that most of them who are seriously preparing would have given the exam, right?
Yes.
Yeah.
Yes, sir.
Yes, sir. Yes, definitely. So it does not actually, we need not extrapolate. Even I thought similar way, but only those 300, 500 people who are giving GTs, they are actually seriously preparing, and eventually it turns out to have a similar pattern.
Correct.
In the final exam.
And the last question is regarding that moment when you saw the rank, because a lot of things, the moment that the results got announced, I'm sure a lot of people will have to look for one rank, but you would have to look for two ranks, and those two ranks, both of them have to be good because you both wanted to be in the same place. Can you just take us through that particular moment?
Sir, actually, we were never expecting a rank of less than 100, because after giving the exam, we did not have a good feeling whether the exam was not good for us. We told everyone that we might not get similar ranks as before as well, because we were not confident. Because whatever exams we gave till now, I had never felt so sad after giving the third part C for the exam. So first, we went and saw my rank, and she was with the phone, I was with the hall ticket, and I told her, and we were shocked to see a rank of 52, and I was really happy. But the next moment, I was tense that what would be her rank, because even after being happy for my rank, we were tensed about her. And then later we went on to see her rank, and it was 3. Then we were like,
We were
shocked.
shocked.
We thought whether it is serial number or rank. So then we messaged our hall tickets and the PDF to
Our
friends, and we told them, please confirm with us that whether our ranks are same. And then they called us, congratulated us, and the next moment we told our grandparents first, followed by our parents, and they were extremely happy.
Right. I think this year has been a wonderful year. What a new year you are having. The next 3 years, you get to decide, which college, which branch you're planning to take. I think it's a blessing by God that you have been rewarded, with such awesome ranks. And Kranti, one question to you: Are you used to getting single-digit rank, or is this your first single-digit rank?
Yeah, this is my first single-digit rank.
Right. Okay. So that's great. Like both of you outstanding ranks, both 3 and 52. Can't take anything away from you. Outstanding, and salute to the hard work.
Yes, I would like to add one thing. I just forgot to mention this thing. I have given INI Neuro also, and I have been following you thoroughly. And I have been in the groups, all your groups, and the WhatsApp message group for Neuro. Whatever you used to put on that group was a main thing for my INI preparation. Like you used to put some topic, I used to go and read that topic. That helped me a lot in my INI preparation. That was core for my INI preparation. That helped me a lot
Your
in INI.
INI CML rank was your INI
19.
CML 19. Right.
Yeah.
Right. So happy for both of you. And
Yes,
I think rather than just both of you, I am seeing a family, just not yours, your parents, grandparents. It's a family that has become happy, an entire family that has become happy with the announcement of this results, and so happy for both of you. Hoping to see you all maybe someday in maybe some conference or somewhere. So thank you so much for joining, and wish you good luck for your future as well. Thank you so much.
Thank you so much, sir.